observed at various levels by carrying out advocacy for sensitization of the community. Also, Anti-Dengue Month is observed in July every year for acceleration of all preventive activities well before the onset of monsoon. By incorporating dengue control under corporate social responsibility activities, development partners may support in various activities for prevention and control of dengue at various levels. The improved surveillance systems using newer technology with close monitoring is always helpful in timely containment of any vector-borne disease that we are now dealing with. There is a need for operational research on development of newer diagnostic tools, vaccines, and vector control methods. Innovations in these areas may significantly improve our dengue control efforts. I'm told that there are new technical guidelines that have been put in place, and I'm sure this symposium will help in disseminating those guidelines and a newer approach to doing things. I was told that the ASHA incentive that has been always there for identifying and eliminating sources also needs a relook. I think we will have a discussion on that when we get back from this meeting in the near future, and see how we can incentivize our frontline workers to become our partners in this process in a more effective manner. I wish this symposium all the best and all the participants a very warm welcome. Thank you.
Thank you so much, ma'am, for your insightful words. Now I would like to invite everyone, all the dignitaries on the dais, to please launch the IEC materials, which will be disseminated to help sensitizing the community and other stakeholders on prevention of dengue. I would now invite Shri Rajesh Bhushan Sir, Secretary Health and Family Welfare, to please give the inaugural address for the symposium.
Have a seat. Very good morning to all of you, my colleagues in the ministry, ASN MD Roli Singh, Joint Secretary looking after this particular program, Shri Rajiv Manjhi, Dr. Tanu Jain, Dr. Tran, Professor Dr. Ashutosh Biswas, participants from various states, ICMR and other institutions from sister ministries and departments in Government of India. This is an important subject, and at times, in fact most of the times, it gets ignored because it happens every year, and over a period of time it seems that we have become used to seasonal outbreaks of dengue, malaria, chikungunya, and what is required is, and we all know what is to be done, and we also know that there is no vaccine, there is no targeted medicine. So therefore, what is required is that each state and each union territory must have a clearly defined plan of action. And the role of the Union Ministry of Health and Family Welfare is to provide a template on which such a plan of action can be formulated. While I was sitting here, I was asking Rajiv, will you be in a position to say that after 2 days of this technical seminar or conference, each state went away with a standard template saying that this is the structure, this is the template on which I must now flesh out a plan of action to tackle dengue in my state? If that one outcome can be achieved, we would have met the expectations. It's not as simple as it appears to be, because as people who preceded me have said, that this is a intersectoral kind of exercise. Let me explain how, by concretizing, by taking an example. Let's look at the kind of activities which are happening in our urban environment, which are broadly coordinated by the Ministry of Urban Affairs and Housing. There is the smart city intervention which is now going on for past few years. Lot of civil works are going on because of that intervention. We also have multiple other centrally sponsored schemes where money is going to these urban local bodies. Around 7 to 8 types of urban local bodies we have in our country. So that huge amount of activity in terms of civil construction, in terms of digging up huge areas, in terms of construction material getting stacked, whether it is mud or it is sand or it is bricks or it is steel. Therefore, that much more potentiality for water to collect and then prove a breeding ground for all kind of vectors. Why only dengue? For other diseases also. So what is it that we are doing to sensitize our urban local bodies in this respect? A very frank answer would be not much. Although in Delhi, being the capital, you will find that whenever the season is about to begin, you would have these huge billboards saying, let us pledge to ensure that there is zero dengue cases or something. There's nothing wrong in having those billboards. But why they should be there only for 2 months? What is it that we are doing to inculcate an understanding that permeates the thinking and planning of urban local bodies for the entire 12 months of a year? So that's one aspect. When we say multi-stakeholder, let's look at the rural landscape. The Ministry of Rural Development, where I had the good fortune of serving as secretary for some time in Government of India, it looks after 250,000 gram panchayats across the country. 2,50,000, huge number. They also get funds under different schemes, centrally sponsored schemes of the government, particularly Mahatma Gandhi Narega, which is implemented to create assured employment for 100 days for each willing family in the rural area. So how do you create that 100 days employment? By saying, I will prepare toilets, I would make earthen roads, I would create platforms, I would create water harvesting structures, I would renovate ponds. All this activity is potentially creating threats and challenges from the point of view of spread of dengue. So while you give the 14th Finance Commission and the 15th Finance Commission money to Gram Panchayats, while you give Mahatma Gandhi Narega money to Gram Panchayats, are you also trying to educate the elected office bearers of these Gram Panchayats? And when I say Gram Panchayats, I include block panchayats and Jila Panchayats in them. So what are we doing to educate them about the threat of dengue and the potential loss to the rural economy that dengue control and treatment, which is largely symptomatic, would involve? Again, the answer is that we are doing less than adequate work. And these are only two ministries, urban development and rural development. Now let's look at drinking water and sanitation. The Ministry of Drinking Water and Sanitation is responsible for two big interventions. One was to make the country open defecation free, ODF. So as a part of this vision of making the country ODF, a large number of toilets were constructed. However, with the advantage of hindsight, today we can say that some of these toilets do have engineering and design faults, although they are being used. It's not as if they are not being used, but they do have these engineering and design faults, as a result of which they are again proving to be conducive for breeding of mosquitoes and therefore spread of associated diseases. So what do we do to retrofit these toilets or to ensure that the engineering design faults are addressed so that in future such a thing does not get repeated? The other intervention that the Ministry of Drinking Water and Sanitation does is Swachh Bharat Abhiyan, and that is an intervention that we must ride on. It's a good intervention. It can help the public health aspects of dengue, chikungunya and other associated diseases. So we must devise ways and means of utilizing the Swachh Bharat Abhiyan to ensure that our work in the field of dengue control is strengthened. So I just gave you examples of these 2-3 ministries. There are multiple such examples. So therefore, whatever standard template evolves as a result of this 2-day interaction must factor in that these are the works that Department of Health in the state will do. ये काम हम करेंगे, ये काम रूरल डेवलपमेंट वाले करेंगे, ये अर्बन डेवलपमेंट करेगा, ये ड्रिंकिंग वाटर और सैनिटेशन वाले करेंगे. So all those aspects, और ये काम सिविल सोसाइटी ऑर्गेनाइजेशन करेंगे, because they also have a role. So all these aspects need to be there in the state's action plan. So this is one aspect of it. The other aspect that Dr. Tran referred to is the aspect of timely reporting or timely detection or better surveillance. Today, as a result of the 2.5 years of addressing the COVID-19 pandemic, we have a digital platform. It's called IHIP, Integrated Health Information Platform. Presently, it gets reports from 3 sources. Auxiliary nurse midwives, they use their smart mobile to report directly onto the server. From medical officers who are either at PHCs, CHCs, district hospitals, they also report again directly to the central server. And the labs where samples are tested, they also report. That is, lab in charges also report. It's surprising that out of the 33 diseases that are presently covered in IHIP, dengue is not one of them. Why should it not be covered? When you already have a ready-made vehicle, it's like saying I have a Mercedes car, lekin main isme baithunga nahi. Why would you not sit in that Mercedes? So please get onboarded onto IHIP. So this whole issue of timely reporting, better surveillance, and if reported in time, therefore treated in time, all these will be addressed. Yes. There is a ready-made vehicle. Why should states be submitting a separate report and IDSP should be submitting a separate report? Ye Tanu aapke liye, Dr. Tanu Jain. Why should you get report from multiple sources? Where is the need? And why should we waste everyone's time? State अलग से report कर रहा है, IDSP अलग से report कर रहा है. Why? Let everyone report on IHIP. वो auxiliary nurse midwives जो ANM हैं, we have 300,000 of them in our country. 3 लाख हैं. तो वो तो सारे राज्यों में हैं. They are in the states. Your medical officers are in the states. Your lab in charges are in the states. So let them report. And let there be only one single unified source of truth. So I think now I have overstated my case. So let us hope that at the end of the 2-day deliberations that you would have, you would come up with a standard template which will assist the states and the UTs to develop a plan of action which will then be implemented straight away. I wish you well. मैं आशा करता हूँ कि ये जो 2 दिन की आप चर्चा करेंगे, उसके सार्थक परिणाम निकलेंगे। मेरी शुभकामनाएं आपके साथ हैं। बहुत बहुत धन्यवाद।
Thank you so much, sir, for your guidance to set the agenda for this technical symposium. I will now invite Dr. Tanu Jain, ma'am, Director, NCVBDC, to please deliver her vote of thanks.
Very good morning. Sadar Namaskar to all of you. It is my pleasure to deliver the vote of thanks to all on behalf of National Center for Vector-Borne Diseases Control, Ministry of Health and Family Welfare. Sir, in the beginning, I would like to express my sincere gratitude to our Secretary, sir, for being with us on the inaugural sessions, despite his extremely busy schedule. And giving a due importance to this technical symposium. Sir, we have followed every word that you have spoken, and all your guidelines will be incorporated in the true spirit, sir, and we assure you that by the end of the 2 days, we will have a very good multi-sectoral framework for dengue control and prevention ready. We have been, sir, trying extensively to include the other ministries, sir, as you very rightly pointed out, that this is not alone the work of the health, and that is why, sir, today for the symposium, we have contacted the 4 ministries and representatives will be here. And at state level also, sir, we will request the states today to reactivate their task force. The task force are existing in the state, but they need to be reactivated and interministerial discussions to be held well in time. So, sir, we are in the end of March, and before the transmission season has also started because unprecedented rains are there, and many states have started reporting dengue cases, sir. So this symposium will actually galvanize the activities at the state level also, sir. And so, sir, thank you so much, sir. I sincerely thank Roli Singh, Madam, Additional Secretary and Mission Director. Ma'am, personal thanks to you because you were very exhausted and we requested you that please join us because, sir, ma'am, this is very encouraging for us because you are our MD NHM and the states are very encouraged when they see that you are supporting this cause. And ma'am, the dengue, chikungunya, and then Zika and the concern for yellow fever is very high. Sir, what we have seen in the states, as the malaria, Kala-Azar and lymphatic filariasis is decreasing, the arboviral diseases are increasing. This is a very paradoxical kind of thing which is happening. So, sir, even in Nagaland when I was there, I realized that they were not worried about the malaria at all. The dengue cases have increased, and there are a lot of, sir, interstate and inter-country issues. Like the border issues are becoming very prominent, sir. Like Nagaland was having an issue from Assam. Assam is a hotbed for JE, and they were having labor, so the JE cases are coming there, sir, and the vector is there. So we are very much concerned. And also, sir, yesterday only we had a meeting with the seaports and the airport authorities also to, tighten that grip, sir, because the laborers are now traveling, sir. I saw 200 labor traveling from the airport to Leh, from Dumka and Pakur areas of Jharkhand. I don't know what kind of diseases they will carry. They will stay there for 7 months. So, sir, this is very important to have those migrant labor also to be looked into and checked, which we will be doing, sir, in our action plan also. And, sir, we are doing it holistically for all vector-borne diseases. So, sir, that is something we are doing. So, once again, thank you so much, ma'am, for being with us today. I extend my sincere thanks to our Joint Secretary, Shri Rajiv Manji, sir, who has always supported, encouraged, and made us stay very late at night to work. So thank you, sir, for guiding us. And, and all my officers are always complaining that, madam, it is becoming very hard and we are staying pretty late. But sir is always driving us very hard to perform. So we'll assure you, sir, that under the able leadership of all of you, we'll be able to perform. And sir, thanks are due to Dr. Tran, who at a very short notice also agreed to grace the occasion and shared his experience. And we are, sir, coordinating for various regional review meetings, sir. We had last year 3 regional review meetings with the support of WHO. And also, sir, we had clinical trainings which we are giving. Sir, our case fatality rate has been sustained to less than 0.1 for almost 10 years now. And sir, Dr. Ashutosh Biswas and his team is here, sir. We are extremely thankful and grateful to sir for being always there for helping us. Sir, right now in Bhubaneswar, we had a clinical case management training and we are doing it round the clock, sir. We are not waiting for the season to start. So we had it last month and it was all the states we are covering, sir. All the medicine and pediatric doctors from across the country. We are getting 2-3 nominations from the district hospital medical colleges and we are making them master trainers to cascade the training down to the PHC and CHC level, sir. Sir, I would also like to sincerely thank Padma Shri Professor A.P. Dash, Vice Chancellor AIPH University Bhubaneswar. I have already thanked Dr. Ashutosh Biswas and other experts from WHO, ICMR headquarters, institutes, NCDC, CGHS, and sir, we have hospitals, AIMS, Safdarjung, RML. So all representatives are here, who will discuss and deliberate on the important topics during the symposium. I express my thanks to the participants from regional offices. States, sir, we have identified on the basis of their high endemicity. Municipal corporations and partner agencies are here, sir. We also thank Sir Godrej CSR for logistic support through CHRI Innovations. And I express my thanks to my dengue division, and special thanks to Ma'am Dr. Kalpana Barua, who has retired 2.5 years back, but she still has the passion to be with us and work day in and day out as an officer, sir. So I think a huge respect for her from our side. And sir, the whole team that she has nurtured, sir, in the dengue division, I think I find them the most active team. And they're always there day in and day out. And sir, now dengue division is also headed by Dr. Pranab Jyoti Bhuiya, who has joined recently. So we thank all the team members for working very hard to make this symposium successful. So thank you very much, sir, for this. And sir, IHIP, sir, you have said about IHIP. Sir, we are doing malaria, and we have already onboarded almost all the states in malaria. I think WHO will have to give us a little more support. So we will do it, sir. हम कर लेंगे, sir. Dengue थोड़ा form में difference है, sir, and there's a issue of sentinel sites. And sir, kits का भी थोड़ा issue है, sir. Like we are only relying on the ELISA data because RDT kits are not having a good sensitivity specificity. So जो sir IDSP में data आ रहा है, that is also coming through the RDT kits, which we are not taking in account. So that is, but sir, we'll do it, sir. Surely, sir. Thank you so much, everyone. Thank you, sir.
Thank you, ma'am. We have now come to the end of the inaugural session. I request the dignitaries and participants to please assemble for the group photograph. Following this, we will all break for a cup of tea at the Hunt Room, which is right next to the conference room. We'll assemble at 11 o'clock for one of the most important panel discussion that awaits, which is on the role of interministerial convergence to fight dengue.
So clearly expressed key topic of every opening. पूरी बात माननी पड़ेगी, ज्यादा ऊपर मत भेजना. Yes, how are you? Always on the online, but now live. Please.
आ जाइए सर.
साइड में तो आ ही जाएंगे.
हाँ.